Good evening, dear viewers, and a warm welcome to our today's episode of Visite. A wonderful weekend has passed again. I hope it was nice for you. And what I really hope is that you enjoy this summer with everything that summer has in store for us. That you have put aside the fears that are behind us. There is no longer any need to keep them. A person who feels healthy is in no danger. So may we succeed, because we need that, this physical warmth, this being together, this understanding, this meeting. All of this is so good for our health. And what is very important this summer, stock up on vitamin D. With a sufficient vitamin D level, which you should all measure in October, please, you go strengthened into next autumn and winter. And I wish all of us that it will be a good autumn and a good winter. Of course, we are not yet able to judge this from this perspective. But what we can do now is so important. Thank you very much for your replies, and I want to get started right away. Somebody asked for my second opinion. This is Andrea, and Andrea writes that she watches the Visite programme on Sundays with great interest, and also the talks and congress lectures. That's a very interesting development at the moment, that we are all observing that through the possibility, not only through QS24, but also by many other providers, congress lectures take place on a wide variety of topics, which of course are also accessible to each individual. And through this I can already acquire a great deal of broad knowledge. And I'm very fascinated by the really wonderful speakers that are sometimes acquired here. So that you yourself as a human being always feel well and safely advised in each of your own decisions, and maybe also to form your own opinion. First, listen to people to whom it is very important to share things from their own wealth of experience and from their own knowledge with these corresponding possibilities. But I'll come back to Andrea's email. She writes that she got blood results and she's deficient in B12 and is now taking Anchorman with 1,000. I think it's micrograms a day. I can't see now if these are drops or tablets, but she takes it. The GOT value of the liver is increased, and that would actually be the first time since 2019 that something like this is noticeable. In 2016, 5 years ago, she gave birth to little Helena and breastfed her for 3.5 years, so that's a long time. I really wish that every young mother would breastfeed for 1.5 years, but 3.5 years is really great. It is known that I have fusel alcohols again and again, and I just find myself bloated and my bowels are not regulated properly. I try, of course, to treat my liver kindly. I think what you mean by that is that you eat very consciously, that you are a vegetarian because you say you do not eat meat, and that you're asking if there is anything else I can suggest that you can do. You are currently taking Symbioflor and haven't been drinking alcohol for years. According to bioresonance, little Helena has pinworms, and then you temporarily gave her Vimox. What actually didn't treat the whole thing really well. But somehow you have the feeling you could do more and just want to know what to do. But you would have already stopped eating gluten and milk and therefore have less flatulence. Yes, this is how many people express their concerns in this direction. And first of all, you have to say that every pregnancy costs strength, and every pregnancy, of course, gives a lot of your own organism, and please don't underestimate all of that. So what you've achieved in 3.5 years, or even through pregnancy, that was a lot more to give than to have taken. And deal with your body now with a greater degree of acceptance. That you are actually giving it everything it needs now. And as far as I'm concerned, the way you design it is not very well balanced. Maybe that's the key to everything. Because the first thing are really proteins. Proteins are granted 70% as a building block. So to build an immune cell, to bring an estrogen back to life, to organise a hormone synthesis, transaminases, cells, millions of cells, need to be renewed every day. That needs protein. And now if you cut down on dairy products, which is very valuable, but then I wonder, where is the source of protein? Is it mainly vegetable protein? Is it quinoa? Is it lentils? Is it beans? Or maybe it can also be an egg. What about fish? I couldn't tell from your email now. But please pay attention, or sometimes it helps in the evening before going to bed, to really add the 8 essential amino acids again. Because through this pool of 8 essential amino acids, they have a provision available to the liver after just 20 minutes without the protein producing sufficient ammonia as a side product. Because every protein digestion in the intestine takes about 4 to 5 hours. So please don't underestimate the protein, because the great responsibility, and I don't want to offend anyone who really says out of respect and humility and awe for the life of an animal, it really doesn't matter to me. I don't want to eat meat. But if there were approaches, then the responsibility for the animal really stands above everything, and above all, the quality of this meat. And just from grazing cattle, which was allowed to live outside, has grazed, you must not underestimate the vitality that suddenly reaches you. And apart from the high proportion of omega-3, also B12, these are things that should be balanced very well. So this is very important and must be seen first. You have not written to what extent you may also be exhausted. I couldn't tell from that. Vitamin B12 has already been a topic several times in these programmes. Might be good at 1,000 micrograms a day. The question is, how do you take it up? Vitamin B12 is not absorbed as well, so it is recommended to take it liposomal or subcutaneous via the mucous membrane. It can also be injected subcutaneously as methylcobalamin. But please make sure that you know where and how your vitamin B12 levels are. Because you wrote that they are low. I can't see exactly how low it is now, because it depends on how much B12 I take and in the oral form, and if it is still swallowed, then only such a small proportion is actually present. So I always like if it is either a level measured in the blood. For example, the normal level has 190 to 900 pg per milliliter. That's the unit of measurement. And when you have 300, it means that it is in the reference range of, or 400 in the reference range. And when you have 1,000, for God's sake, I have too much. That is impossible. You cannot overdose on vitamin B12. But vitamin B12 isn't in the blood. Vitamin B12 is needed intracellularly. And I want to know that you have 900 and more, and not a value below 190. So is it measured in the blood, or is it perhaps the methylmalonic acid that you measured? This is a value that shows me whether the nitrosative stress on a cellular level is not too high. And the methylmalonic acid shows me whether the vitamin B12 is even reaching the cell. And this methylmalonic acid is a very important value in the urine, but also a very important value in the blood, in the homocysteine. And I know about homocysteine. If homocysteine is high, it is a factor of atherosclerosis, vascular calcification. Why? Because the homocysteine only arises for a conversion into methionine. And this methylation process is not granted by homocysteine because vitamin B12, folic acid and vitamin B6 are missing. That is why there is sometimes an indication of an increased homocysteine for this lack of methylation and a sign that vitamin B12 is needed. But not only B12, please also have an active vitamin B6 and above all, folic acid. And with folic acid, there is still a small problem because the folic acid has to be converted from the reduced to the active form. And if you buy a normal folic acid supplement and take it, and still feel that after 3 or 4 months the homocysteine level remains elevated, then you may have a defect in this methylation process. A genetic defect in the conversion that the body cannot accomplish this process from inactive folic acid to active one. This is very important because folic acid, that is vitamin B9, triggers an incredible number of integrated processes. And without the folic acid, cellular energy metabolism is not possible at all. That means please make sure to always buy an active folic acid, the so-called folate. This is important if the methionine or folic acid is not converted into the reduced form or is converted from the reduced to the active form. Then the very brain toxic glutamate is produced, which of course has an impact on our nerve metabolism. And these things are very important that you also recognise and know them. Elevated liver values, this GOT or ALAT and ASAT and gamma-GT, these liver enzymes only appear elevated in the blood when the liver cell in your cell structure is no longer strong enough. So it's a sign of increased liver stress. Either this enzymatic effect is overwhelmed, or the liver cell is simply also weakened in its structure. That means now, of course, for the intestine, that bloated stomach, these fusel alcohols, especially when you may still eat fruit in the evening, if there's also a severe dysbacteria in the intestine, if it is a so-called putrefactive dyspepsia, that is a microbiome that has to rebalance itself over and over again every day. The small intestine needs a healthy pH of around 8.5 for that. The large intestine needs a pH value of 5.5 to 6.5. And especially the interaction with the stomach. This very acidic environment that triggers from 3 to 4 down to 1 to 2 makes a lot of sense for protein digestion. And the interplay between the pancreas, between liver, bile, between gastric juice, takes care of a stable and powerful state in the small intestine in the breakdown of our nutrients. And it's only when these nutrients are broken down that they can be absorbed into the body. It is important to understand that the enzymatic power of the liver and the pancreas should not be underestimated, that the cause lies in a dysregulation of the small intestine. Therefore, there is a feedback to the organs to go back with the enzymatic power, because the development of the enzymes in the small intestine is not given. That is why it makes a lot of sense to simply look at digestive residues with a stool sample, which of course also support these fusel alcohols and this flatulence. So it makes a lot of sense. 2, to measure elastase, an enzyme that the pancreas makes. That is why the digestive residues are used to measure the enzymatic power to digest fat, carbohydrates and proteins, and you get indirect conclusions about the individual organs. Gluten, which has been discussed very often, is the basic requirement to find peace here and just relieve your body of this high inflammation factor, because that's what gluten does. That's actually gliadin in our grain. The adhesive protein ensures silent inflammation and makes an irritation to the intestinal lining. Therefore, the responsibility for a healthy microbiome today always goes in the direction that you really cut out gluten grain bread based on grain, so rye, spelt, barley, wheat. Triticum, for example, and really relieve the intestines and the intestinal system here. I would consider that to be very important. And then, of course, maybe a liver detox. Liver detoxification, perhaps according to Moritz, or adapted to really bring the digestive capacities of the bile into balance again. Also think about intestinal biofilm. You mentioned that the little one has pinworms. According to the bioresonance examination, that means pinworms themselves are oxyurs, Enterobius vermicularis. And for children between the ages of 3 and 8, 95% of children have either oxyuris or roundworms, or are also parasitically loaded, because with life and with their little hands they put everything in their mouth again and again. These are partly smear infections, but that also affects the mother. That means, to what extent is there also a parasitic treatment by Artemisia or by Mimosa pudica, which is a great hermal remedy for parasites. And we have had very good experience, even with children. You simply open the capsule and stir it into applesauce or a liquid. These are very important things, because pinworms in particular, when the little one complains about itching in the intestines, then you have to know about pinworms, that the eggs are ingested via smear infection. Touch something, a fly or something not wiped off. It's very quick for the children. And in the intestine, so only after about 2 weeks, the larvae develop into the new really small pinworms. And these little pinworms are then, of course, sexually mature again, whereby the men then die after fertilization. What a fate. But then, of course, the females can really lay up to 10,000 eggs again. And this outward going pinworms, they are always in the anal canal. And I remember them from back then that for the kids in the evening there has been adhesive tape out on the buttocks, perennial around it, in order to really see in the morning. This is sometimes not as visible to the naked eye, how these little worms have settled. So these really are very valuable things, and they don't go past a mum either. That means if you're putting the intestines in the focus of the action at the moment, then you should too please try to be connected to life, and of course very connected to the little one. Give life the chance of parasitic detoxification of the intestines by enemas after the full moon, garlic enemas, and with this Mimosa pudica or rysol with the black walnut. There are different things. Sometimes, and I do not want to hide that, it is also important to take a remedy like Vermox or albendazole. And that means then as an adult, maybe 3 days in a row. And then in the so-called merry-go-round system, 3, 4, 5 weeks, only once a week. But at that moment, I think this problem is really being dealt with very well, and maybe the whole system, which has somehow weakened in the course of these years through the strength of pregnancy, but also through the long period of breastfeeding. And please always think carefully about minerals. You also have to examine minerals. To what extent there is still enough potassium intracellularly, still enough magnesium, whether that it's in a fairly good balance, extracellular calcium, of course, and very important to you, of course, think especially of your good vitamin D levels then combined with K2, and pay attention to your calcium level. This is very important, and I hope that I could help you with these thoughts a bit. And you can now really take, with all your power, new things into your own hands and find a way for the little one to really get rid of parasitic loads. This is something that we usually really underestimate, especially with children, even after such an intestinal cure. And that should be said to you as a mother too, via effective microorganisms or via Regulat or organic apple cider vinegar or good probiotics to bring the system back into balance. But the real art is through a high quality diet that's also rich in fermented vegetables. And if you want to know how to practice fermentation at home, which is pretty straightforward, I can just recommend you TV QS24's Kitchen Talk programmes. There are incredibly great recipes that Federica and her little Stephen will bring you closer to. Also, how you do it, why you should do it, so you can actually deal with these issues and really get involved with joy and pleasure. And this is actually the greatest thing we do as doctors. We always have to succeed that we convey the pleasure of health, and that doesn't work without getting involved. That it is important to yourself to do it, and that one also learns about health from many things in life that one also experiences. Life is a great learning process, and in the process you develop into a person who goes through this life very consciously and also happy, and of course puts you in a healthy, strong and resilient situation, especially in this very present time. With this in mind, thank you very much for your attention, and have a wonderful Sunday evening. And I'm really looking forward to the next one. Goodbye.